As we age, it seems the eyes have it. What is it? Cataracts. But look no further. Dr. Wynne Morley has a vision on how to counteract cataracts. So let's see what she has to say. Dr. Morley is a Cleveland Clinic ophthalmologist at the Richard E. Jacobs Health Center in Avon and at the Elyria Family Health and Surgery Center. Welcome to the show.
Thank you.
Well, let's first of all, what are cataracts?
Glad you asked. We actually made this like one of our exam rooms where we even have a poster similar to the one that we have if you were to come in and tell us that you were having some cataract symptoms. It's always easier for me to describe what a cataract is if I can show you on a picture. So here's a picture of the eye. This is the front of the eye, and that's the back of the eye. And this is where the lens of the eye is. When we're young, it's crystal clear and lets the light pass through and give us a nice clearer image. But as we go through life, the cataract is growing and has more layers that keep developing around it. As the layers develop, it starts to become cloudy. And
so we can't see as well.
Exactly.
Okay, so describe what we actually do see when you're looking through cataract.
The cataract tends to develop slowly, and gradually one's vision becomes more and more blurry. People can start to notice that they're having to turn the room lights up in order to read better. Or when they're driving, they can start to notice that the headlights are bothering them when they didn't used to, especially at nighttime and in the rain. Other things people can notice are that the colors start to get darker or yellowish. And some people can even describe a doubling of the vision in the eye that has a cataract.
Okay, so you really can tell this is happening.
Yes.
All right, so is it something that you have to have surgery or some kind of treatment right away, or how does it progress?
Well, if you start to have symptoms that are interfering with your quality of life, for example, you can't do the things that you need to at your job, or you're having difficulty driving or reading, then call the ophthalmologist. Come on in, and if we discover that you have a cataract, then it is treatable surgically.
Okay. Is surgery like the only option for treating cataracts?
Yes. If the vision has gotten to be bad enough to affect the quality of life, then usually the only treatment option is surgery.
How does that work? What do you do in the surgery?
Well, I operate at the Cleveland Clinic's Lorraine Ambulatory Surgery Center, and patients come in and oftentimes like to be awake. And if they are, then they get to watch pretty colors while we're taking the cataract out.
Okay.
But there are some patients who say, that's okay, I'd just as soon be a little more relaxed.
Yeah, I think that would be my category.
And if that's the case, no problem. We have a nurse anesthetist working right there with me, and they have an intravenous line that's going, and they can give you a medicine that's called Versed that makes you relax.
Okay.
We then put some numbing drops on the front of your eye.
So it doesn't hurt at all?
It doesn't. It feels comfortable.
You don't have to be afraid of the pain then.
Exactly. So while you're either relaxed and not aware as much or watching a pretty color, the surgeon is looking through an operating microscope that magnifies the view, and they're using a little device called an ultrasound that vibrates, and it breaks the cataract into little enough pieces that they can suck the pieces out through a tiny incision.
Okay, and what do they put in place of the cataract?
Well, you may remember your grandmother having had cataract surgery and then wearing thick Coke bottle glasses
really
afterwards.
Thick ones, yeah.
Thankfully, that's not the case anymore. There are lots and lots of choices for implants that are placed into the same capsular bag that held the cataract. And we talk with you at length before the surgery to help you decide which implant is best for you. There are lots of different options. Some of the implants can help you to see well in the distance. Other ones help you see better up near. Some people like to have one eye for distance, the other eye for near. And then there's some people that have an out-of-round shape of the front of their eye, and they even have lenses available now that can correct that inside the eye. They're called toric lenses. Also, there are lenses called multifocal lenses that we would talk with you about as well.
It sounds like there's a lot of options and some successful surgery that can be done. So, if you have cataracts, see for yourself how much better your vision can be. Give Dr. Morley a call. The number is coming up next. And if you can't read the number easily, you better put Dr. Morley on speed dial. Call right away.
For more information, contact the Cleveland Clinic, www.clevelandclinic.org. Next, how to avoid paying huge federal estate taxes.